I do.
Over to your right, doctor. Just please watch your step as you go forward. If you need a glass of water or something, let us know. We'll do our best to accommodate you. The only thing I ask, if there's an objection made during the course of your testimony, just pause, let me rule on the objection, and we'll go.
Yes, sir.
State, you may inquire, you're ready.
Thank you very much, Your Honor. One moment. Good morning, doctor.
Good morning.
Almost afternoon. Will you introduce yourself to our jury, please?
I'm Rachel Thomas. I'm an advanced practice registered nurse with the University of Florida.
Thank you, ma'am. And what's your current occupation as you sit here today?
A PRN, so advanced practice registered nurse with the University of Florida, and I'm also a professor of nursing at UNF here in town.
And what is the UFFCCPT? What does that stand for?
It stands for the University of Florida First Coast Child Protection Team.
Yes, doctor. And what is that?
So we're part of a system of child protection teams around the state of Florida, and the child protection teams are all set up to assist with different kinds of investigations when children are the alleged crime victims.
All right. And what are your specific duties and or responsibilities with respect to that group?
Well, I'm a nurse practitioner, and so I'm part of the medical arm of the program. So I conduct medical evaluations of alleged child victims for a whole host of different reasons.
All right. And can you give us an idea of how many years you've been engaged in this type of practice?
Around 22.
That's 22 years, correct?
22 years.
In March of 2018, specifically the month of March, were you employed in the same capacity with UFFCCPT?
I was.
Can you give the jury an idea of where you obtained your education, ma'am?
Yes, I can. I have a PhD, which is a doctorate of philosophy. It's a science degree in nursing science and a minor in sociology from UF. And I got that in 2002. And prior to that, I got a Master of Science in nursing from UF in family practice and became a nurse practitioner based on that degree. And prior to that, I went to Jacksonville University and got my BSN, which is a Bachelor's of Science in Nursing.
All right. And in order to keep any licensing or certifications that you hold, do you participate in any continuing education?
Yes, I do.
You describe that, please. And just in summary.
It's quite a lot of continuing education. I am a certified CPT medical provider. That is a designation by the Florida Department of Health. And so I have to keep up continuing education hours to maintain that one. I have an APRN license from the Florida Division of Nursing regulation, and they require a certain number of hours. I'm also nationally board certified by the American Nurses Credentialing Center, and I have to renew that every 5 years, and there are a lot of hours for that. So it's a lot of ongoing education required to keep all those certifications current.
Thank you very much. Are you current in your certifications as you testify here today?
Yes, I am.
How about March of 2018?
Yes, I was current then too.
What is a sexual assault medical assessment? SAMA. What is that?
So in our setting, it is a reference to the type of evaluation that is done in some cases when there are allegations of sexual molestation, sexual assault, or other types of sexual abuse of children. And there's a certain very structured way of doing that kind of evaluation because often there is a need to collect evidence.
Now, is the organization, the UFFCCPT, part of any law enforcement arm, like the Jacksonville Sheriff's Office, anything of that nature?
No, the whole point is for the child protection teams around the state of Florida to be independent. So we're purposefully not affiliated with DCF, which is Department of Children and Families, and law enforcement. We work closely with them sometimes, but we're a whole separate entity, part of the University of Florida Department of Pediatrics.
Thank you. Now, is the purposes of what you do for purposes of diagnosis or treatment of particular patients and or victims?
Yes, many times we are diagnosing, and we're not technically a treatment facility per se, but sometimes we're diagnosing something that was mistakenly identified as child abuse, and because we're all current in our areas of practice, either pediatrics or family practice, we are fully capable of diagnosing. And then usually if a child needs treatment, we refer to a specialist or their primary person in the community.
Now, these sexual assault medical assessments, can you give our jury an idea of how many of those approximately you've done in your career?
I tried counting several years ago, and it was over 500. So in the thousands.
Is that also true with respect to the number of gynecological examinations you have performed in the course of your entire career?
Oh yes, even more than, it's in the thousands.
Ma'am, have you ever testified in the area of sexual assault medical assessments and or examinations before?
I have.
Approximately how many times?
More than 50.
And specifically or generally where? What courts? Was that here in Northeast Florida and Duval County? Can you explain?
Mostly I've been here testifying in the Duval County Courthouse, but our team is a large team, and so sometimes it takes me to other counties. So I've testified in Volusia, Baker, St. John's, a little bit across the state lines in Georgia, Camden mostly, and there have been one or two times I've had to go further up in Georgia.
All right. I want to shift gears and direct your attention to what you did in this case. I want to direct your attention to March 16 of 2018 with respect to an individual. We'll use her name once, IYANA SAWYER. Did you meet with a young lady named IS?
I did.
Right. And was that approximately the date of when you did the examination, March 16 of 2018?
Yes, it was.
At that time, was IS 15 years of age at the time of the examination?
Yes, she was.
Can you tell us where this takes place, just in general?
Yes, this examination took place at the University of Florida CPT office. Some of the exams take place in hospitals, but she came to our office on this particular day.
All right. Do you remember this? Do you remember IS?
I have a vague memory of her. Yes.
Now, ma'am, do you compile a record and or report as you're conducting and or during or after you do the sexual assault examination of IS?
Yes.
You have that in front of you or with you?
I do. I brought it with me.
You reviewed that prior to coming to court?
Yes, I have.
What does the word forensic mean when you, like, for example, forensic examination? What does that mean?
Mm-hmm. Well, for me, as a forensic nurse, technically, although that's not primarily my job is about health and well-being and safety, but one component of what I do is forensic. And it means that some elements of my job entail being very detailed about particular types of findings. So it might require techniques like photography that's a little bit different, a little bit beyond the scope of general nursing. It often involves collection of evidence, things like clothing, skin swabs. We sometimes use alternative light sources in forensics to see if there's any particular types of fluid on clothing or even on people's bodies. So there's some elements that are forensic that you don't really get training for as a general nurse or even nurse practitioner.
Now, with respect to this young lady, and if you have to refer to your report, just say so. Do you recall what her date of birth was?
I have to refer to my report. I know she was 15, but I have the sexual abuse medical assessment report in front of me, and her date of birth was September 6th, 2002.
Thank you. Now, would you happen, as you sit here today, have an independent recollection of what her demeanor was during this examination?
Only vaguely. She was cooperative, conversant.
You remember who was with her?
Yes, I do.
Who was that?
Her mother was present. I need to look at my report to see if she was actually in the exam room. Sometimes they are in the lobby, but it looks like her mother was actually with her during the exam, and then one of my colleagues was also present.
All right. Now, at the beginning of the examination, can you tell our jury like how that begins, what you do first as you begin this examination?
Yes, I can. I always talk with the person in front of me first. If they're verbal, we see some children that are too young to tell you a whole lot. But with a teenager, especially a 15-year-old, my general method would be to talk with them. And it's in broad terms. I never start with like a specific allegation. That's considered a no-no in forensics. You want to be as objective as possible. So I probably just asked her something like, what brings you here today? And as I said, you know, my main goal is health, safety.
Give us just a general summary of what she advised.
I saw her on a Friday of this week, and she reported that there had been 2 different episodes of a sexual assault by an adult person in her neighborhood.
All right. And the 2 separate incidences that she described, were they on separate days or was it all in one?
They were on 2 separate days of the same week.
Did she disclose anything additional to than the 2 episodes that you're describing?
No, she did not.
All right.
She's-
And can you just give us generally what the first episode entailed with respect to the allegations?
I'm going to reference my report because she gave
Absolutely.
me some direct quotes. So this adult person in her neighborhood convinced her, is what she said, convinced her, and had been talking to her prior to this. So the first time there was an assault, it was an afternoon after school on that Wednesday, and it was oral and what we call penile vaginal intercourse, or PVI. And so then again on Thursday of the same week, she said the same thing happened Thursday, except he didn't do oral, and I don't know if he used a condom.
Now, again, the date of your exam, and if you have to refer to your report, please confirm so, but was it March 6th, 18?
Yes.
Did she describe anything in additional than the 2 isolated incidences that you just described
No,
at that time?
at that time she did not.
Did that prompt you then, ma'am, to perform an evaluation of the physical person of IS?
Yes, it did.
All right. Can you describe what you did when you conducted this examination?
So after speaking with an alleged victim, I get some additional information about their medical history. I want to know about their overall health. Sometimes we prescribe medications and things. So I ask general questions. I ask about pregnancy or last menstrual period, things of that nature. And then I conduct a physical exam. I call it a head to toe exam. And it's very similar to any time someone has a physical. There is a GYN component or a gynecological exam. And I modify that sometimes depending on how relaxed a person is. But I can do everything in our office that would be done in a GYN type office or situation.
All right. And who remains, if they do, in the room when this is happening?
Whoever the child wants there. Usually, if they're young, they usually want a parent. And in this case, the child's mother was present. And then I always have at least one other person there as a chaperone and also to help me with different components of the exam.
All right. And now directing your attention specifically is when and how you're conducting the examination, do you try to collect specimens in this examination? And if so, explain.
Yes, I do. Depending on the time frame. So the general guidance is if alleged victims present to our office within a week of some kind of contact where there might be body fluids still present from another person, an assailant, then we, even if they have had a shower or something, we try to collect skin swabbings, and sometimes there are also internal body swabs that are taken, and then sometimes clothing, if there's a chance that there can be any kind of transfer of someone else's DNA onto a child victim's clothes. And then we sometimes will do photographs of the child depending on the circumstances.
All right. And what is the purpose of taking these particular specimens? What is it specifically done for?
Well, it's done to assist the investigation. The police generally don't like to take skin swabs, even from the cheek. They prefer that a nurse or a physician do that. But it's to see if there's any foreign DNA on skin or in internal parts of the anatomy. And it's done to corroborate statements that are made during the medical evaluation.
Thank you, doctor. Now, you indicated she was in during this examination on a Friday. Is that correct?
Yes, I did.
Was the Wednesday and Thursday the two incidents she was describing the day prior and 2 days prior to when you saw her?
Yes,
So it was very recent.
very recent exposure, which is why I did some swabs.
Doctor, I want to show you what's been marked and admitted into evidence as State's Exhibit number 6060. You recognize this, please? And if so, tell us how you recognize it.
Yes, I recognize almost all of this, except there's a pair of underwear I don't necessarily recognize, but the other packages, there's a large yellow package that has my handwriting and my signature on it. There are 4 white envelopes that have my signature and my handwriting, and there's another white bag that is sealed with my signature.
Okay. And am I pointing at where it says Examiner R. Thomas? Is that you?
Yes, that's me.
And is this information that you would have placed on here and or your staff during the course of the sexual assault examination?
Yes, it is.
So as I'm holding this exhibit, ma'am, what I want to ask you first, let's just talk about the 4 small envelopes in the middle first. What are these that we see, these 4 white envelopes that we see in the middle?
Yes, closer. So they're all envelopes that contain Q-tips. If you open them up, they look like pretty standard Q-tips. The difference is these are Q-tips provided to us in a sealed fashion by FDLE, and we use them to swab different parts of the skin or of the anatomy, and we package them in a very careful way so we don't put our own DNA in the packaging, and it has to be sealed very in a very systematic way. So we're keeping everything very sterile. We only want the collection of the potential DNA in that envelope.
All right. And is the top right envelope, does that have IS's name on it?
It does.
Does it have the date of the examination?
Yes.
Does it have your name, Dr. Thomas, on there?
Yes.
And is that on the top right an internal, what's referred to as a vaginal swab?
Yes, it is.
All right. And the 2 that are on the bottom of State 60, the 2 white envelopes, do both have the same information as just described?
Yes.
And does one on the bottom left indicate this is a swab of the vagina?
Yes, it does.
Most specifically, the labia.
Yes.
And is the bottom right envelope a swab of the neck?
Yes.
And the specific body location is left neck.
Yes.
And is I think I covered it, but the top right envelope, is that what we call vaginal swabs?
Yes.
The top left one is what's called, some people call it buccal or buccal cheek swabs. What are these in the top left, please?
That's a swab taken from the inside of her mouth, and that's the control swab, so to speak. So all the other swabs and the other packages are compared to that one we know is her.
All right.
So we have a sample from the alleged victim, and then we have other samples.
Okay. Now, with respect to the top right, the full right item, I know you say you don't recognize the particular underwear. Is your name on the packaging?
Yes, it is.
Does it say collected by R. Thomas?
Yes, it does.
Was it from the patient IS?
Yes.
Was it collected as part of this sexual assault kit, March 16, 2018, the date of the examination?
Yes, it was.
So, doctor, as I hold up State's Exhibit 60, what we see on the right-hand side of the exhibit, is that underwear?
Yes, it is.
Is that underwear that you would have collected from IS during this examination?
Yes.
Is it underwear that she indicated that she was wearing during the assault? If you can recall.
If I recall, and I'll look at my report, but it was underwear she put on after a shower is my recollection.
Okay. What, if any, effect would that have on your ability to collect either semen or DNA or transfer DNA or touch DNA, any DNA whatsoever? If any?
You mean the showering?
Yes, ma'am.
So sometimes the shower gives everything away, but in teenagers, we found that sometimes they don't shower, try to collect anyway. And we're also getting internal swabs where you might not be applying water. And so even if it's post showering, is because there can still be some transfer of body fluid or liquid into the source of evidence with kids.
Okay. Is the purpose of collecting and bagging and securing the underwear for potential testing for DNA from FDLE? Did you do any swabbing to this?
No, I did not.
All right. In turn, just so the record's clear, I pointed at the underwear. Did you package and preserve it for the potential for Florida Department of Law Enforcement to do swabbing of this particular item?
Yes, I did.
Once you collected all the items in the sexual assault kit, did you have the package that you have them and secured as you normally would based on your training and experience?
Yes, I did.
Now, once those items leave you after the sexual assault examination, you don't see them again. Is that correct?
Not unless there's a trial.
Like you are now, unless I show it to you in court.
Right.
From when you did the examination until now, you hadn't seen those items.
Correct. No, I have not.
Now, as you concluded your examination of IS, ma'am, did you, what if anything did you do during that particular examination? Other than what you've described.
As I concluded it, well, I gave medications to prevent infections based on the statements that she provided. I thought there was at least a reasonable chance of a sexually transmitted infection, and we have those medications that can be dispensed. So I talked to her and probably her mother about the medications. I dispensed a morning after pill because I was concerned about the risk of pregnancy since there was uncertainty about condom use. I recommended she come back for follow-up testing, and some kids just opt out of that because the experience was bad and they don't want to come back. And but we did discuss follow-up testing, and I wrote my report and wrote up the findings of the exam, and the report went with the evidence. It's packaged all together.
All right. Will you just briefly give us the protocol of how it leaves your agency and or CPT and goes to law enforcement? How's that?
Yes, it's a very specific protocol. We call this chain of custody. So you want to make sure that you can say exactly where the potential evidence started, and each step along the way is accounted for. So all of the evidence in real time during the exam is in the room. I can see it all. And I'm responsible for ensuring that it all gets packaged properly, that there's proper sterile techniques, so to speak, not like surgery sterile, but we don't want our hands touching anything. So we wear gloves, we do a lot of hand hygiene, hand washing. And then the packaging, you've already seen what that looks like. All of that happens in real time in the exam room. Nothing leaves the room without being sealed and signed by me. And then in our office, if we don't have an officer there waiting, we have a locked room where the evidence is stored. It's logged in. We used to have a handwritten log, and now we are more sophisticated, and we have a laptop because now we have this track it system where we can, the suspected, the victim can track their own kit. So there's a process of logging the evidence until it's picked up. If it's not a direct handoff to police, it's stored in a locked, very secure location until the detective comes or the appropriate law enforcement officer. They have to sign it out. And then the same process happens at every level where that evidence is passed off into FDLE, and then if it goes anywhere else after that. It's very, very detailed process.
And now when evidence does leave you, do you even know whether it goes to FDLE for future testing?
I don't know where it goes after it leaves our office. I'm responsible for while it's there and then making sure it gets in the proper hands.
Right.
Then I don't always know after that.
All right, thank you very much. Now, ma'am, that was with respect to an evaluation you did with respect to IS on a prior sexual assault. Moving forward in this particular case, were you asked to either check the effects of certain substances and or supplements at a later date?
I was.
You recall when that was? And if so,
I have that report. I wrote a consultation report for the detective who was involved at that time and had asked me some questions about certain kinds of supplements. And so the date of that consultation was April of 2019. So just over a year later.
now, was that Detective Billy Abbott?
Yes.
All right. And were you asked to talk to them or advise them or to check in your duties, as you've described earlier, to determine the effects of either parsley and or dong quai and or the use of those together with respect to the effects that they would cause?
Yes, I was.
Were you specifically asked also to determine if either one of those or if those taken together could cause a female to miscarry?
Yes, I was.
What sex separately or together?
Yes, so I am fortunate to work for the University of Florida and I can access all the vast library resources. So I was being asked a question by Detective Abbott that I'm not usually asked, and it's a question that could fall into the auspices of somebody in toxicology or pharmacology. So I remember having that conversation with Detective Abbott that, you know, although I'm not a toxicologist, I would be happy to look up information on parsley and dong quai. So I checked 3 sources within the UF library databases, a lot by physicians, and it's kind of for like real-time clinical decision makings. Or if you have a patient on a certain medication, you might want to check drug-drug interactions. So I checked PubMed, I checked MD Consult, which is another very similar type database for clinicians, and then I checked clinical pharmacology, which has a subset of information about toxicology. So that means, you know, any potential poisons. So I did some research for Detective Abbott.
And with respect to those 3 databases that you checked in your role that you have previously described, did you come up with the consistent effects that either dong quai or parsley would cause in looking at all 3 of those?
Well, what I found was parsley is relatively mild, but the dong quai was worrisome from the research I did because it is absolutely contraindicated. In other words, there's no good reason to ever give it to a pregnant person.
Would you ever describe dong quai to any female that is pregnant?
No, I would not.
Now, is dong quai considered a category X item? And if so, explain what that is.
Yes, it is. It's a very old Chinese herb. So the caveat is that herbs aren't exactly treated the same way as drugs, you know, where there's a lot of FDA regulation. But the guidance from that research I did is that it should be treated as a category X. So in the FDA language, there's all these pregnancy risk categories. There's really not an A because almost any medication has some potential harmful effects, even if mild. So usually B are the milder medicines that we might use during pregnancy because they're very low risk and you can watch for low side effects, all right? And then it goes up from there. C is a little higher, D is even higher, and then you have X, which is absolutely contraindicated. So dong quai should be treated as a category X.
Does that mean it is unsafe under any circumstances during pregnancy?
Yes, that's exactly what it means.
Would you, ma'am, walk through, and if you have to refer to your report, I'll just ask you item by item. If given to someone who's pregnant, and I'm specifically only referring to dong quai, If that is given to someone during pregnancy, can it cause excessive bleeding?
Yes, it can.
Can it cause uterine muscle spasms?
Yes.
Can it cause blood vessel dilation?
Uterine muscle, blood vessel dilation. Yes.
All right. Does that in effect uterine bleeding?
Yes.
Would it cause hemorrhaging?
From what I read in the research, yes.
Would it cause uterine spasms?
Yes, that's a potential. All these are potential risk factors. Yes.
Of course. What about premature labor?
Potentially, yes.
And what about a miscarriage?
Potentially, yes.
And what about fetal demise just in general?
Potentially, yes.
One moment, Your Honor. Doctor, those questions that I just went through at the end, is that with respect to the effects of Dong Quai individually?
Yes.
What if you were to combine that with parsley? Did you find anything in the literature? Well, let me start. It's parsley something we all use in cooking, for example.
It's really common herb, very mild herb, has a lot of different supplement uses and cooking uses, sure.
Did you find anything in your research or in your training or experience or your knowledge that gave you the indication that if you add parsley to Dong Quai, what in addition would that cause other than what you've just described?
There was a suggestion in what I read, and again, this would be a better question for a clinical pharmacologist, because that's what they do, is they look for substances that can potentiate something else. So if you're taking one thing, does it exacerbate the potential side effects? But from my reading of the research, because parsley has some effects on the clotting pathways in the body, and Dong Quai does too, that the combination of those could be, it could have a potentiating effect.
Would that mean that the items that we just went through, the effects that this causes individually in the Dong Quai, would the parsley exacerbate that?
Potentially.
Thank you, Doctor. Your Honor, nothing further. Thank you.
Yes, sir. We'll finish up. Afternoon, Doctor.
Good afternoon. Thank you. Yes, sure.
In relation to the bill, specifically Dong Quai and parsley, you just said that you are not a pharmacologist, right?
That's correct.
And so what you're basing it on is what other people have written in the U.S. or other people's experience, right?
Well, it's other people's experience that are in the pipeline of evidence-based practice. So there's the information I read, they weren't just opinion articles. They were articles with some scientific validity. I didn't just go to some Google search, but yes, with that caveat, yes.
And matter of fact, the first time we talked, you didn't even want to give an opinion because this wasn't your area of expertise, right?
I don't recall exactly what I said the first time we talked.
You said you didn't want to give an opinion until you had time to research, but you didn't know. Would that be accurate?
Well, are you talking about the first time we talked for my deposition?
Yes.
So I had done the research. I think at that point in time, I hadn't reviewed the consultation report that I did. So I wanted to go back over that consultation report.
But other than, again, you're not a pharmacologist, so you stated this isn't something you would recommend or you would prescribe, correct?
So that was two questions. So no, I'm not a pharmacologist. I'm a nurse practitioner with 20 plus years of experience, including prescriptive authority and prescribing a variety of things. And no, this is not something I would prescribe or even endorse for someone that I thought had childbearing potential.
And when you were contacted in April of 2019, were you contacted by Detective
That I don't remember. The person's name that is on my report, because I wrote up a consultation report and I attached 4 pages of additional information from clinical pharmacology so that that would be provided directly in concert with the report I wrote. The person's name on the report is Detective B.H. Abbott.
Is it possible you were also contacted by a detective or at some point?
It's possible. I've had fairly frequent contact with her off and on over the years, so it's possible, sure.
And as you were asked by the state, the known side effects would be that of the conducting of urine bleeding and things of that nature. It's not used for that at all.
Yes, the only thing I kept repeating is the known potential side effects, because I think some of this would be dose dependent, and I didn't have all that information.
And not having that information, you can't say what, if any, effects this would have had. And again, it all depends on the dose. You have the answer.
I don't know. I think dosing would be important to really get down to the brass tacks of how harmful something was. But I can tell you, any amount of a category X medication or supplement is bad, potentially bad. That's the whole definition of category X medications and supplements, is that the potential harms far outweigh the benefits to even trying it.
So let's back up to the first time IS was at your office, okay?
Okay.
All right, so she comes to you the first time, and as you stated, in the room for her was also her mother, right?
Yes.
All right, now, she was there because she was sexually assaulted, correct?
Yes, those were the allegations I was asked to assess.
And as part of the
Yeah, we can't, I don't know, they don't want y'all to hear too many questions. So what I'm gonna do is stop it right here. That was the nurse petition. She testified for IYANA SAWYER. All right, y'all. Y'all have a great night, day, evening, whatever it is in your country. I'm out.